Hi guys, welcome back to MediPeace. Today I'll be sharing most important topics you need to focus on while preparing for any anatomy exam. So let's go. Normally we have subdivision under anatomy. We have the gross, the histology, and the embryology. So we'll be starting with the gross part. Number 1, upper limb. The key topics to note under upper limb include 1. Humerus, 2. Brachial plexus, 3. Axilla and breast, 4. Arms muscles, 5. Forearms compartment, 6. Joint, e.g. the shoulder joint and the elbow joint. The wrist joint is also part of it. It's very important. 6. You have the arterial anastomosis around the scapula and elbow. 7. You have arterial supply, which include axillary artery, brachial artery. So you should know the cause, relation, division, branches, and clinical correlation. The nerve supply to the upper limb, the median nerve, the ulnar nerve, and the radial nerve. Next, you have the anatomical areas, which include 1. Cubital fossa, anatomical snub box, quadrangular space, carpal tunnel, Guyon's canal. Under lower limb, the key topics include the femoral triangle, the adductor canal, popliteal fossa, supply to the lower limb, which include the femoral nerve, the sciatic nerve, and the obturator nerve. Know everything about these nerves. The hip joint and knee joint. Know everything about hip joint and knee joint. You should know the articular surface. You should know the capsule. You should know the movements. You should know the clinical correlation. Just everything under these two joints. You should know it. The arterial supply to the lower limb, the femoral artery and popliteal artery. You should know everything about this artery. Structure passing through lesser and greater sciatic foramina. Very, very important. You should know it. You should also read about the femur. Read about the femur vastly. The foot bone and arches of the foot. Very important. Next, you have the venous drainage of lower limb, which is the most important vein. There is the great venous vein. You should know the cause, the origin, the distribution, the branches, the clinical correlation too. We also have the gluteal region. Know everything about the gluteal region, the muscle, the innervation, the arterial supply, and the actions of the muscle. Next, we have the posterior, medial, and anterior compartment of the thigh. Know all these compartments. For the thigh, it's very, very important. We also have the last but not the least, the inguinal lymph node. Know everything about the inguinal lymph node. Thorax, the key topics include the pericardium and heart anatomy, the coronary circulation, the mediastinum division, the lungs and bronchopulmonary segment, surface markings of heart and lungs, the ribs and thoracic outlets, the flare chest, pleural effusion, intercostal nerve space, and arterial supply to this space. Cardiac tamponade. Next, we have the teratology of phallus. It's an abnormality under development of the heart, diaphragm, and the openings. We have key topics that include the inguinal canal, and hernia. The hernia is the clinical correlation for this canal. We have the peritoneum and omental fossa. Next, we have the stomach, small intestine, liver, pancreas, and spleen. Know all these organs, their anatomy, and their clinical correlation too. Under pelvic organs, you should know the basics of bladder, uterus, rectum, and prostate gland. Now, abdominal aorta is very important. Know everything about it. Read about it also. And portal vein and portosystemic anastomosis. Know the spermatic cord and contents. And key topics include cranial fossa, the sinuses, facial nerves, nose, the nasal cavity, the lateral nasal cavity. You should know the eyes too. You should read on the eyes, the extraocular wall muscle, and read on triangle of the neck. Read on the scalp layer and blood supply. Next, you should read on pharynx and larynx. Next, you should read on thyroid, parathyroid gland, and you should also read on facial compartment of the neck. You should also read on cervical plexus of nerves. You should also read on parotid gland anatomy. You should also read on infratemporal fossa, cerebropalatine fossa. You should also read on the tongue nervous system, mandibular nerve, facial nerve, and read the lymph drainage of head and neck, and also know the maxillary artery. Start with the brainstem. Know what brainstem is all about. You should also read about the ventricular system and the cerebrospinal fluid, that's CSF. You should read on internal capsule. You should read on cerebellum. You should also read on spinal cord tract, the interior and exterior features and the lesions. You should also read on all cranial nerves. Know their nucleus, the cause, the distribution, the way they exist from the skull, and the way they exist from the brain. You should also read on the white matter of cerebellum and classification of nerve fiber. You should also read on the cerebral cortex and its lesion. Next, you should read on function of all lobes of the brain. You should also know the basal ganglia and know its lesion. You should also read on arterial and venous supply of the brain, and you should read on arterial and venous supply of brain and cyclus arteriosus of Willis. You should know the limbic system and the upper and lower motor neuron and its lesion. And lastly, you should read on the visual pathway and the lesion. Actually, we don't really have a specific pathway you can say you should read on histology. So you should focus more on, I think, almost everything, which include the epithelial tissue, very, very important, the muscle tissue. You should also read on respiratory histology, urogenital histology, bones and cartilage, that is connective tissues. You should read on CVS, of blood vessel and heart. You should read on integumentary, reproductive histology, and lastly the digestive system. You should read also from week 1 to week 4. Next, you should read on head and neck development, that is pharyngeal apparatus, very important. You should read on CVS development. Then you should read on GIT, gastrointestinal tract development, the stomach, esophagus, and every other thing. You should also read on musculoskeletal development. You should also read on teratology. You should read also on urogenital development and also twinning and implantation. Also read on menstrual cycle and regulation. The last one, which is the sperm and egg development. All these topics are very important. These are the most important topics and chapters you need to read on. Like, focus on them very well when preparing for any anatomy exam. I'm telling you, if you read this, you are almost 100% ready for any exam concerning anatomy. So if you find this video very helpful, so give it a thumbs up and comment. If there is something I'm missing, nobody is perfect, so comment, make a comment, drop your own suggestion so that other people can learn from it. So see you in the next one.